myself Anugrahaa, Assistant Professor from the Department of Psychology. I am here to discuss regarding post-traumatic stress disorder. So today we are going to discuss regarding the causes and DSM criteria and treatment of PTSD. Before getting into the topic, I would like to explain regarding the terms stress and trauma. Stress is a physiological and psychological response to a challenging and threatening situations, while trauma refers to extremely stressful situations that causes serious impact. Examples of trauma are maybe sexual abuse, accident or death of a loved one. Not all stressful situations will result in trauma, but all traumatic events are intensely stressful. The stress caused after a traumatic event, it is called as the post-traumatic stress. So the symptoms of post-traumatic stress are heightened anxiety, intrusive thoughts and difficulty in sleeping. And I would like to differentiate the term between fear and anxiety. Fear is an emotional psychological response to a threatening situation, while anxiety is a response to a situation that is yet to occur. So that is called as anxiety. And intrusive thoughts is nothing but involuntary images or thoughts regarding the unpleasant event. It is called as the intrusive thoughts. Generally, many people tend to have the post-traumatic stress after a stressful event, but individuals are diagnosed under post-traumatic stress disorder if they meet certain criteria. So PTSD is a more severe and persistent form of post-traumatic stress, and individuals are diagnosed under PTSD when they meet the specific diagnostic criteria of PTSD, and the individuals also impairs in many important functioning of their daily life. So next we are going to learn about the diagnostic criteria of PTSD. So the particular person should encounter the traumatic event directly, or the person should witness the traumatic event occurring to others, or they would also have learned the traumatic event occurred to a close family member or a friend. And also when the particular individual is experiencing or repeatedly exposure to a traumatic event, they might feel stressful and it will result in PTSD. And the next criteria is intrusive symptoms and thoughts. The particular person tend to have intrusive thoughts and memories regarding the traumatic event. They also tend to have dreams related to the event, and they also tend to have dissociative reactions, that is flashbacks. Flashbacks is nothing but recurrent occurring of images or thoughts regarding the particular event, and the individual tend to have intense or prolonged psychological distress when exposed to the particular traumatic event. Psychological distress means that particular person might feel low and they find difficulty in doing their daily routine, and they find difficulty in concentrating things. And the other symptom is marked physiological reactions to the cues. When the individual faces stimuli or cues related to the particular traumatic event, they tend to have physiological reactions, and it might include palpitations, increased heart rate, sweating, etc. And the next criteria is the person tend to avoid the stimulus that is in association with the traumatic event. They tend to avoid the particular situation or image or the context that is relation with the traumatic event. For example, in the movie Gagi, the particular individual tend to avoid the yellow color dress, and she also advises her sister not to wear the yellow color dress, because during her childhood she had faced a sexual abuse, and during that point of time she had wear yellow color dress, and whenever she wears yellow color dress, or when she sees someone is wearing the yellow color dress, she tends to go back to the traumatic event and relate with it, and so she avoids a particular color dress. So this is the other diagnostic criteria. And the next one is negative alterations in cognitions and mood. The affected individual tend to have negative belief or expectation about themselves and and the outside world. They tend to lose hope and they tend to self blame themselves and they tend to doubt themselves and the people surrounded by them. And they also tend to have distorted cognitions about the events. The individual tend to find a difficulty in forming interest and they tend to move away from things, they doesn't involve in any things or doesn't volunteer in any activities. So they show diminished interest or participation in activities, and they also feel detached from everyone. They does not spend time with their loved ones or their close ones. They always wanted to be detached from everyone and they also wanted to be feel alone. And persistent inability to experience positive emotions, because an individual tend to blame themselves for the particular event, and since they also lost hope in everything among themselves, among the world and among the activities, everything, and so it results in negative emotions. So they find difficult in experiencing the positive emotions. And the next criteria is marked alterations in arousal and reactions associated with the traumatic events. After facing the particular traumatic event, the individuals might experience 2 or more symptoms of the following things. They might have irritable behavior or angry outbursts, or they might behave aggressively towards people around them, and they might involve in self-destructive behavior. It might result in suicide. And hypervigilance. Hypervigilance means the person tends to feel more sensitive even to a small thing or a small stimuli might also trigger them, and they feel overwhelming about the particular stimuli. And problems with concentration. The individual finds difficult in concentrating things, they lack concentration and they find difficult in putting their utmost efforts in things. They also tend to have sleep disturbances. Either the person may have insomnia or hypersomnia. Insomnia means very decreased amount of sleep, and the exact opposite is hypersomnia. The person tend to have extreme amount of sleep than the normal person. And this is the last criteria. The duration of the disturbances must exceed more than 1 month, and so the person could be diagnosed under PTSD. And the person also tend to have significant impairment in social, occupational and other functioning. And next we are going to see about the causes of PTSD. The person, since a person have encountered the traumatic event directly, or when they have witnessed the traumatic event according to their close ones, they might have the probability of developing PTSD. And the next one is biological vulnerability, that is genetic factors. If a person's family member is already experienced PTSD, the particular individual have the higher probability of acquiring PTSD. And the structural and functional abnormalities in amygdala, hippocampus and prefrontal cortex have been associated with PTSD, because these are the more important things in the brain, and their functions are memory, fear response and personality. So when there is abnormality in these things, it might result in PTSD. And then the imbalance in neurotransmitter like norepinephrine, dopamine are also linked to PTSD, because the hormonal balance is very important to function effectively. When there is an imbalance in the neurotransmitter, it affects the particular individual, and it also affects their mood and emotions and the way they handle things. So when there is an imbalance, it results in PTSD. And the next one is psychological vulnerability. When the individuals have already a numerous amount of uncontrollable or unpredictable event in their life, they have an increased probability of acquiring PTSD. And the personality traits like narcissistic personality and pessimistic attitude towards their life also increases the probability. And the next one is social factors. When the individuals lack social support, risk also increases, because when the social support lacks, the individual finds difficult to overcome from a traumatic event or a critical situation. When they have their support group, they find furthermore easier to handle the particular situation. The next one is severity and nature of trauma. If the traumatic event is more critical and more intense, the individuals might have increased risk of acquiring PTSD. So next we are going to see about the treatment of PTSD. So first, exposure therapy. The individual is motivated to confront about the traumatic event. It might be their emotions, their situations, or the things they have handled during the traumatic event. So by doing so regularly, the particular person might over the time, the particular person might feel less emotional response to the particular stimuli that is related with the traumatic event, because when they addresses the particular event numerous times, the emotions tend to decrease when compared to the first time. So this is the motto behind the exposure therapy. And the next one is cognitive therapy. Cognitive therapy addresses the maladaptive thoughts and beliefs related to the trauma. For example, when a person tend to blame themselves or the person surrounding around them, and when they lost hope in everything, so to address these things, the cognitive therapy is used. And cognitive processing therapy is combination of exposure therapy and cognitive therapy. And the next one is pharmacological treatment. The pharmacological treatment is used to balance the imbalanced hormones or neurotransmitters, for example SSRI. And next one is combined approach. The combination of psychotherapy and medications works effectively in the treatment of PTSD. Thank you.